so vividly remember this. Perfect day, we had driven from LA at this really beautiful vineyard. I started to have kind of shooting pains down the back of my leg. I couldn't move my legs. I didn't know what was happening.
My first reaction would have been, Amanda, you need to get in a plane and come home. I know you're uncomfortable, take OxyContin and come home. I would have been responsible for paralyzing my daughter.
My friends had no idea what to do. I was in a ton of pain, but they brought me in to the emergency room. They shot me up with a ton of morphine, which did take away the pain. Small regional hospital did not have an MRI machine that was working. They did prescribe me a 30-day prescription of Oxy and sent me on my way and said, if you get back to LA, if the pain persists, go back and see a doctor. The next morning, we drive back to LA, and when I tried to get out of the car, I couldn't. 911 was called, and then I was taken to a hospital, which does have MRI capabilities, but they were so overrun with the ER, the emergency room was absolutely packed. I was on a stretcher in the hallway with a morphine drip. Didn't have enough space, they didn't have enough doctors. The treatment that they offered me was morphine and another 30-day prescription of Oxy. I even said, hey, no, I actually have already a 30-day prescription of Oxy. I don't think I need more of that. I think I need an MRI. And they said, yeah, you probably do, but we're not gonna admit you. You're not in enough pain. This is all we can do and send you home. Basically, the next 3 days were like a living hell. And my mom had private health through her employer. So she said, I'm gonna call private health and see who they might recommend or refer to try to get you treated.
When this happened to us, we were first of all stunned because I didn't know what to do. Both of us felt completely helpless in terms of how do we help our daughter. And then she made this one call.
A few hours later, my mom called and said, hey, be on the lookout for a call from Nicholas at Private Health. I was super scared, I was super nervous. I got this call from this very warm, very reassuring, very knowledgeable person. And so Nick came up with a plan to actually have a doctor come and examine me. That doctor came, and you need an MRI to be able to know what we're dealing with. And so the doctor said, look, you can come to my office tomorrow morning and get an MRI, but you can't really walk, so I'm gonna give you a steroid. The next morning, waited less than an hour for the results of the MRI. The doctor walks in, and I'll never forget this. I just had to step out because I wanted to call my colleague, who is a top spinal surgeon in LA, and ask him to clear his schedule because he's going to be performing spinal surgery on you as soon as possible. And he said, Amanda, you have what is considered the worst level of herniation in your back. It has to be removed immediately. As soon as the doctor left, Nick called my phone and he said, what you just heard is the recommendation. We vetted it. He already had the MRI results reviewed by multiple other doctors at this point, a top surgeon in LA. He's operated on like professional athletes, and he's a really great guy. He himself has had this type of back surgery. Our health and care system in the United States is so difficult to navigate that having essentially a quarterback working for you with your best interest at heart, that's what the private health team was doing. They were quarterbacking every appointment, every follow-up, every test result. They were getting everything reviewed by multiple sources. I mean, you can't do, I don't think you can do that on your own. I am healthy today because private health helped me twice. I ended up having a spinal fusion surgery in 2020, and private health helped me navigate that as well.
As far as I'm concerned, private health saved our life, saved my daughter's life. As a father and as a parent at that moment, I feel like he saved my life, and my wife would say the same.